Everybody, Tina here. Hope you're all doing well today. Today, we're going to talk a little bit about weight loss in breastfed babies. Now, it is pretty much formula fed or breastfed babies. All babies lose weight when they're first born. Um, for formula fed babies, the average weight loss is about 5% of their birth weight. For breastfed babies, it can be between 7 and 10%. So they can lose a little bit more, and it can take a little bit longer to gain it back. All babies should usually, like I said, usually the weight loss is within the first 5 to 7 days, but usually by 10 to 14 days, they've most babies have gained back their up to birth weight. So again, not uncommon for babies to lose weight at the beginning. However, one thing that troubles me is many times healthcare professionals are not taking into consideration a C-section baby. And when you have a C-section, or even if you have an IV or other fluids during a vaginal delivery, those fluids, it can take longer for the scale to to look. It can look like baby weighs more when they're first born, and so when they lose weight, it can tend to look like they are losing more than they actually are. So obviously, I don't want you to think that it's not important to have weight checks. It is. Um, but I can remember, especially with my first, feeling kind of panicked, um, and feeling like, when he lost weight at the beginning, and feeling a little bit of pressure even. Thankfully, one of the doctors I spoke with, it took a long time for my milk to come in with the first one, especially come in, you know what I mean? Milk is kind of already there and waiting to go. But for I had colostrum, and baby has colostrum for those first however many days. But for my second milk to come in, for the one when it changes and it looks different. So it took a little bit longer, but thankfully the doctor that I had, told me to hang in there and keep doing what I was doing. Many times moms panic during this period and think that they need to supplement. However, sometimes there are medical reasons, and so I don't want you to not pay attention. I want you to pay attention to baby's weight gain, but take into consideration that it can take a little bit longer to gain that weight back, and give it a little bit of time, and just keep nursing as often as possible. But like I said, most babies gain the weight back between 10 to 14 days. Another thing that is not uncommon, unfortunately, is that sometimes the pediatricians are using older charts, growth charts, that are really based on artificially fed infants. So I think it was 2006 that the World Health Organization, updated those charts. So make sure, be your own advocate and make sure that your doctor is actually using the chart for breastfed babies. It's not the same as with formula fed babies. So that's important to take into consideration. So ask, find out, make sure that the chart that they're using is actually the newest one for breastfed babies. There are reasons that babies can lose weight at the beginning, or, above and beyond the normal weight loss. So obviously the most important thing is to make sure baby has a good latch and is transferring milk. And, if there's something going on medically with baby, or if baby has either a medical reason or just not a good latch, not transferring milk, those all can be problematic, obviously, and can cause weight loss above and beyond what the quote unquote normal amount would be. So you want to make sure that things are going well and baby has a good latch. So reach out and get the help either with me or another lactation consultant, your doctors, and get a good support system around you, to make sure that things are going well and baby's putting out diapers and gaining well. So another thing to take into consideration is breastfed babies during the first up to 3 months or so tend to actually gain a little bit quicker than formula fed babies, usually, statistically speaking. and then less rapidly from 3 to 12 months. So, if you get to the point where the growth slows down a little bit, as long as you're on a good curve and it's not a dramatic loss, that's not uncommon. So, at the beginning, baby can be really sleepy, especially if there's been a C-section or medications um, administered to mom. Um, Sometimes it's easy to overuse a pacifier. You really should be nursing really frequently during the first few weeks or so to get, and even thereafter. I mean, every baby's different, and some babies will go longer and eat more frequently, less frequently. But at the very beginning, nurse as often as you can to bring your milk supply in and to practice that latch and to just feed on demand and watch out for those hunger cues. So yeah, so weight loss in and of itself is not uncommon for all babies. But if you've had a C-section, you've had a lot of fluids, um, those are things to take into consideration. Make sure your latch is good. Make sure you're getting the support that you need. Um, yeah, and if baby's a little bit older and the weight loss is going down, maybe there's something else going on, an ear infection, baby's not feeling well, a thrush can make it real uncomfortable to nurse. So make sure you just have a really good support system around you and never ignore, obviously, weight loss. It's a very important thing to watch out for. Just keep in mind that it's not uncommon for it to happen. And one of the biggest mistakes I see is doctors looking at wrong growth charts, perhaps, and you know, kind of panicking, wanting to make sure all their bases are covered, so to speak, and telling moms to top off baby after breastfeeding. And that can really, especially during those really important early weeks, can really not be a good thing as far as building your supply. Best way to build your supply is to nurse as often as possible. Breastfeeding is the law of supply and demand. I know I say it a million times, but it's true. The more you nurse, the more you put baby to the breast, the skin to skin contact, all those things, the more milk your body will make and respond to making. So as long as everything is normal and there's no health, nothing underlying going on, it's um, not uncommon. Just keep an eye on it and just nurse as often as you possibly can. And always, always, if you have any questions, ask your pediatrician. Never ignore that, but at the same time, don't panic and feel like you have to add formula when many times that can really mess up your supply. And get the support you need, get the help you need, reach out and ask for help. So hopefully this has been helpful to you. If you have any questions, feel free to, if you're my client, you can text me, you can call me, you can check me out on Facebook. And reach out and get the support that you need. And I look forward to talking to you all soon, and keep up the great work because it really is a great work that you're doing. Okay, I'll talk to you later. Bye.